So hi, I'm Kristina Clark. I'm from both the University of Oxford and UCL in the United Kingdom, and we're here at the USTAR conference, and I've got the pleasure of being able to interview Professor Masa from Tokyo on treatments in interstitial lung disease. He's just given a fantastic talk about different treatments and different options, and I thought I'd just start by asking you, what are you most excited about in the developments in interstitial lung disease treatments in scleroderma?
Thank you, Kristina. So I think the treatment of SSc-ILD is a very hot area at this moment. So many clinical trials are ongoing. So many targeted therapies are investigated in different ways. So the basic research, including yours, significantly contribute to the development of the targeted therapies. Our treatment options are now mycophenolate, cyclophosphamide, nintedanib, tocilizumab, and rituximab. But we definitely need more specific and more effective treatment options. So the recent basic research found the many cells and pathways and sort of factors involved in the development of the lung inflammation and fibrosis. So it is very difficult to evaluate the efficacy in the in vitro or mouse models, especially in the patient's SSc. So clinical trial is the only way to prove the targeted therapy, efficacy of the targeted therapies. So I hope some of the targeted therapy are proven to be effective in ongoing clinical trial and will be available for the treatment for SSc-ILD in routine clinical practice in the near future.
And so you mentioned obviously the targeted therapies. What, for our clinicians, what kind of therapy would you choose for, or what kind of patient would you choose for some of the therapies, such as nintedanib or tocilizumab? Are there kind of, when we're sitting in the clinic, what should we be looking out for that means they might respond more to one treatment or another?
Yeah, that is another important point to be solved, because the current evidence shows the response to tocilizumab is observed in a very restricted patient population, and for nintedanib, the GI side effect is a very difficult problem to continue for the long term. So probably some kind of biomarker to predict the response to the targeted therapies, and also predict the safety use of individual treatment is highly useful to choose the best treatment for individual patients.
And are there any biomarkers on the radar that we should be looking out for in the next few years?
Yeah, the KL6 is one of the old biomarkers, and also the recent studies shown the anti-topoisomerase 1 antibody positivity is a good predictive marker for tocilizumab treatment. On the other hand, maybe the patient with anti-RNA-polymerase 3 has more inflammatory phenotype. So maybe the T or B targeted therapy might be effective, but a lot of studies needs to be done in this field. So you should contribute to this.
Perfect. Well, thank you so much. That was absolutely brilliant and very insightful. And it was a fantastic talk that you gave, and we look forward to future developments in interstitial lung disease and the new clinical trials. Thank you.
Thank you.